My name is Lori Martin. I'm a psychiatric mental health nurse practitioner. I currently work on 2 different units where I take care of 5 patients on each unit. And so I'm considered the clinical lead of the team for my patients, and I will work with them figuring out what their diagnosis is, and then work with them trying to figure out if they need medications and what medications they need. I think it's really important to try and work with my patients to find out the best medicine for them. My goal is to help people feel relaxed, help them feel like I care about what they have to say, and that my goal is to understand what they are going through and try and help them along their path to recovery. I could come out and have the list of questions that they've gone through a million times, or I could just have that conversation to see if they're improving. And within that conversation, I can find out how their memory is, how their long-term memory is, how their short-term memory is. Are they oriented? I can figure all that out just by having a nice conversation. So sometimes that might be, for instance, the flower in my hair. I started wearing a flower every once in a while, and pretty soon when I didn't wear one, people would say, "Well, Lori, where's your flower?" So now I wear the flower, and what I've noticed is that sometimes that in itself will start a conversation. Same with my fancy shoes. I have a pair of shoes that are bright red that say, when my toes are together, they say smile on the toes of them. Somebody who last week may not have been able to answer a question or make a statement like, "Oh, Lori, where's your flower?" Or, "I like the one you wore yesterday better." Remembering that I was wearing a flower yesterday, or remembering that I'm not wearing a flower today. So things like that can help me know, is the things that we're doing for this patient, is it helping them along the way? Or are they still not understanding what's going on? So just the privilege of being able to spend time with people and have these conversations, and I get to do this, and it's my job, and it's so amazing. Because we work in a team environment where we have somebody here 24 hours a day recording and watching our patients, we can make changes pretty quickly. So if we see improvement and we know we're on the right track, like, fabulous, we can keep moving down that track. If we see something that's not seeming to be good, we can make assessments and make adjustments based on what people are seeing. Oftentimes, my biggest challenges are also the things that are so rewarding. As a chief nursing officer, trying to figure out how to make sure that our new employees got the orientation that they needed. I was able to help create a training program that could help do that, and then now getting to see how it's seeming to help on the units and change the way that we provide care. I love what I do. I love the staff that I get to work with. I love the idea that I get to see people when they come in who maybe are not doing well. Just recently, I had a young lady who came in, and she had been very sick. She'd been using drugs. 2 weeks later, I'm talking to her. She's doing really well, and she said, "Thank you so much for being here for me. I feel like getting arrested and having to come to the Oregon State Hospital was what saved my life." It feels really satisfying to end my day knowing that somebody's life might be better just for the fact that I was willing to listen, I was willing to understand where they're at and try to help them in their recovery.